Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pharmacology. Question number first. Tetracycline tend to form complexes with options A, calcium ion, options B, magnesium ion, option C, iron ion, or options D, aluminum ion, or options E, all. The right answer is options E, that is all, okay. Tetracycline is an antibiotic which form complexes with calcium ions, magnesium ions, iron ions, and aluminum ions extra. Actually, it's make complexes with metal that group second groups metals, you know, under physiological conditions with that forming chelates complexes. Okay. Questions number second. Hyaluronidase has been used as an adjunct to options A, prevent oxidation of drugs, options B, to increase the absorption of the injected drugs, option C, to produce sustained action, or options D, to increase detoxification. The right answer is options B, that is to increase the absorption of the injected drugs. Okay. Hyaluronidase is that enzyme, which is mainly used as an adjunct in order to increase the absorption of the injected drugs. This hyaluronidase given with other drugs by injection, mainly used to break down that hyaluronic acid that is helps to make the fluid and connective tissue thinner, so that the drugs can move easily into the tissue, so that it helps to increase the absorption of the drugs. Okay. Questions number third. Which of the following compound of undecylenic acid is most commonly used in therapy? Options A, zinc. Options B, magnesium. Option C, manganese. Options D, silver. The right answer is options A, that is a zinc. Okay. Zinc is a compound of undecylenic acid, which is mostly used in therapy. The zinc undecylenate is a natural or synthetic fungistatic fatty acids, or it is an antifungal. Zinc undecylenate is used actually as a topically in a cream form against that fungal infections, eczemas, ringworm, and the other cutaneous conditions. This zinc provide as an astringent actions, and it reduces the rawness and irritations. Okay. Questions number 4. An oral antifungal agent is which of the following? Options A, sopronol. Options B, Decinex. Option C, undecylenic acid, or options D, griseofulvin. The right answer is options D, that is a griseofulvin. Okay. An oral antifungal agent is a griseofulvin. Griseofulvin is an antifungal medications which is mainly used to treat a number of type of dermatophytosis that includes fungal infections of the nail and scalp, as well as that skin. When the fungal antifungal cream have not been worked, it is actually taken by mean of mouth. Okay. Questions number 5. Nitrofurantoin is most active when the pH of the urinary tract is options A, neutral, options B, over 9.5, options C, between 6 to 7, or options D, 5.5 or less. The right answer is options D, that is a 5.5 or less. Okay. Nitrofurantoin is most active when the pH of the urinary tract is acidic, that is a 5.5 or less. Nitrofurantoin is actually antibacterial medications which is mainly used to treat urinary tract infections, but it is not as effective for that kidney infections. It is actually taken by mean of mouth. If we see that common side effect which is associated with this nitrofurantoins includes nausea, loss of appetite, diarrhea, and headache. This nitrofurantoin is reduced by bacterial flavoprotein into that reactive intermediate, which mainly inactivate or alter bacterial ribosomal protein and other macromolecules. Questions number 6. Alloys are used to treat which of the following? Options A, burn. Options B, gastritis. Option C, carcinomas. Options D, vertigo. The right answer is options A, that is a burn. Alloys are used to treat burns. Here are the uses of alloys. That is a first, it contain healthful plant compound. Second, alloys has antioxidant and antibacterial properties. Alloys actually accelerates wound healing. Alloys reduces dental plaque. Alloys helps to treat canker sore. Allows reduces that constipations. Allows improve skin and also prevents wrinkles. Allows that lower blood pressure, blood sugar level too. Allows also used to treat burn. Questions number 7. Which of the following can cause a discoloration of teeth? Options A, chloromycetin. Options B, penicillin. Options C, acromycin. Options D, kanamycin. The right answer is option C, that is a acromycin. Okay, acromycin is a type of tetracycline antibiotics. It's mainly cause a discoloration of teeth, and it is used to treat bacterial infections. That's not work for that viral infection. It is not work for viral infections. Okay. Questions number 8. Which of the following can increase the serum level of penicillin significantly? Options A, salicylate. Options B, probenecid. Option C, kaolin. Options D, antacid. The right answer is options B, that is probenacids. Okay. Proven acids can increases the serum level of penicillin significantly, since proven acids inhibit both the organic and ionic transporters in the basolateral membrane of cells in the proximal tubules, results in reduced clearance and increase plasma level of drugs normally secreted by this mechanism, that is penicillin. This proven acids should not be used along with that salicylates, because their therapeutic actions are antagonistic to each other. Since we know that proven acid is used in order to treat that gout conditions. Okay. Questions number 9. Which of the following diuretics is quite effective even in presence of electrolyte imbalance? Options A, ethacrynic acid. Options B, ammonium chloride. Option C, chlorothiazide. Options D, acetazolamide. The right answer is options A, that is ethacrynic acid. Ethacrynic acid is a quite effective even in the presence of electrolyte imbalance. Actually, ethacrynic acids mainly belongs to that loop diuretics groups, and ethacrynic acid is given to help to treat that fluid retention conditions like edema, and also that soiling conditions, which is mainly caused by like congestive heart failure condition, liver diseases, kidney diseases, or other medical conditions. Okay. Diuretics such as like loop diuretics such as like other like furosemide, it mainly facilitates that elimination of toxicants by altering their passive reabsorptions from the tubular rumen. Okay. Questions number 10. Radioactive decay follow-up. Options A, mixed order rate. Options B, zero order rate. Option C, first order rate. Or options D, second order rate. The right answer is options B, that is a zero order rate. Okay. Radioactive decay mainly follow that zero order rate. Also, there's a glucagon may be used as like a diagnostic agents in radiographic examination of the GI tract. Okay. We already know about that first order kinetics and zero order kinetics, but we doesn't know about like mixed order kinetics. Mixed order kinetics is a type of kinetics where the that both that first and zero order of kinetics are mainly included. Okay. The rate process of such type of drugs which follow that mixed order kinetics show that non-linear kinetics. Okay. Second order kinetics is a term that describing the reactions at which the rate of that chemical reactions is proportional to the product of that concentration of the two of the reactant, or if there is only one single reactant, then it is proportional to the square of that molar concentration of that reactant only. Okay. Questions number 11. A drug that reverses plasma protein binding is often referred to as options A, protein hydrolysate, options B, displacer, option C, carrier substance, options D, enzyme. The right answer is options A, that is a protein hydrolysates. Okay. Drugs that reverse the binding of a plasma protein, that is known as protein hydrolysates. This plasma protein binding results that actually in decrease in availability of drugs, while protein hydrolysates reverses this plasma protein binding, lead to increase that bioavailability of drugs. Okay. Questions number 12. A rich source of vitamin A is which of the following? Options A, lean meat. Options B, liver. Option C, poultry. Options D, fish liver oil. The right answer is options D, that is a fish liver oil. Okay. The rich source of vitamin A, that is a fish liver oil. Okay. The plasma level of vitamin A is actually that affected by oral contraceptive, since while we intake that oral contraceptives, that markedly increase the serum level of vitamin A, or they may decreases the thymine, and they also lower that vitamin B2, that is riboflavin level, and also vitamin C, that is ascorbic level. uh, Absorption of a vitamin A in GI tract is mainly depend on the presence of a bile in the intestine. Okay. Questions number 13. Methotrexate should never be used concurrently with options A, aspirin, options B, penicillin, option C, epinephrine, options D, tetracycline. The right answer is options A, that is a aspirin. Okay. methotrexates should never be used along with like aspirin, since methotrexates inhibit that enzymes which is responsible for nucleotide synthesis, that may include like dihydrofolate reductase enzymes, thymidylate reductase enzymes, aminioimidazole, carboxamide ribonucleotide transformylase enzymes, and aminophosphoribosyl transferase enzymes. Okay, if we take that high dose of aspirins along with like methotrexates, it may increase like kidney problems. Methotrexates along with like NSAIDs may also cause that brief and a mild increase in blood problems like low platelets counts, etc. Questions number 14. An antidote for heparin overdose is options A, protamine sulfate, options B, atropine, option C, calcium salt, or options D, dicumarol. The right answer is options A, that is a protamine sulfate. Okay, an antidote which is used for that heparin overdose, that is protamine sulfate. Okay, in overdose of heparin, at that condition the body is unable to deploy is a natural defense that against hemorrhages, that's excessive bleeding and life threatening blood loss can also occurs quickly. Since that antidote for heparin overdoses may include like protamine sulfates, this protamine sulfate is a highly cationic peptide that may bind to that heparin or also that lower molecular weight heparin to form a stable ion pair. And this complex is then removed and broken down by the reticuloendothelial systems. Okay, uh, anticoagulant acid like citrate dextrose injection is required to be pyrogen free. If we know that pyrogens are those products that cause febrile reactions upon injections. Okay. Questions number 15. Aluminum chloride is used mainly as which of the following? Options A, like aluminum chloride is used as antiemetic. Options B, antiperspirant. Option C, urinary acidifier. Or options D, laxative. The right answer is options B, that is antiperspirant. Okay, aluminum chloride is used as antiperspirant. Okay, aluminum chloride is used actually widely in manufacturing rubber, also lubricant, and also as a used as a wood preservatives and as a paint. It is used in a pesticides and pharmaceuticals product too. Uh, it is used as a flux in aluminum melting. Okay, it is used as an anti-perspirant too. Okay. Questions number 16. Which of the following may be used as a plasma expander? Options A, dextran. Options B, sodium salt. Option C, starch. Options D, calcium salt. The right answer is options A, that is a dextran. Okay. Dextrans may be used as a plasma expander. If we know that plasma expanders are those agents which have that relatively high molecular weight and they can boost the plasma volume by increasing the osmotic pressures. They are also used to treat patients who have suffered hemorrhage or shock. If we see that's a plasma expanders type, then we found there's a two type of plasma expanders like crystalloid plasma expanders and colloid plasma expanders. Crystalloids are that aqueous solutions of mineral salts, or also they are other water soluble molecules. For example, like normal salines, dextrose, Ringer solution. These are the crystalloids. While colloids are the large insoluble molecules such as like dextrans and human albumin, gelatin, blood, extra. Okay. Questions number 17. An antiemetic that contain principally carbohydrate derivative is options A, imitrol, options B, Vasprin, option C, compazine, options D, none. The right answer is options A, that is a imitrol. Okay, an anti-emetic that contain mainly carbohydrate derivatives, that is known as imitrol. Okay, imitrol is actually the over-the-counter drugs. Over-the-counter drugs means those drugs which are provided without giving prescriptions. Okay, anti-emetic drugs that mainly contain a phosphorylated carbohydrate which is used for the relief of nausea, which may occur due to like intestinal flu, stomach flu, and food or drink indiscretions extra. Okay, note that Vasprin, which is a phenothiazine, is actually used to treat a serious mental and emotional disorder, which may include schizophrenia and other psychotic disorder. While compazine, which is a prochlorperazine, is a medications which is mainly used to treat nausea, migraine, schizophrenia, psychosis, and anxiety extra. Okay. Questions number 18. Opium is obtained by which of the following? Options A, slitting capsule of a plant. Options B, extractions from leaf of a plant. Option C, like chemical synthesis. Options D, grinding a plant. The right answer is options A, that is a slitting capsules of a plant. Opium is obtained by slitting capsules of a plant. Opium, which is used as a narcotic drugs, that is mainly obtained from the unripe seed pod of the opium plant, like a poppy, that is Papaver somniferum, a plant of the family Papaveraceae. Okay, opium is obtained by slightly incising the seed capsules of the poppy after the plant flower petals have fallen. Okay, questions number 19. Chlorambucils act primarily as a options A, antibiotic, options B, mitotic inhibitor, option C, alkylating agent, options D, anti-metabolite. The right answer is option C, that is the alkylating agents. Okay, chlorambucils act as an alkylating agents. Chlorambucils is an orally administered alkylating agents, which is currently used in the therapy of chronic lymphocytic leukemia, Hodgkin and non-Hodgkin lymphomas, and it's also really used in severe autoimmune conditions that include like rheumatoid arthritis, uveitis, and nephrotic syndromes. Okay. Questions number 20. For ophthalmic use, boric acid solution should be options A, diluted with an equal volume of sterile distilled water. Options B, diluted with an equal volume of isotonic saline solution. Option C, diluted with an equal volume of distilled water. Or options D, undiluted. The right answer is options A, that is a diluted with an equal volume of sterile distilled water. Okay. For ophthalmic use, boric acid should be used, which is mainly diluted with an equal volume of sterile distilled water. Okay. Boric acid ophthalmic solution is actually an eye wash, which is used to cleanse or irrigate eye. Boric acid provide soothing relief from the eye irritation and also helps to remove pollutants such as like smoke, chlorine, or other chemicals. Questions number 21st. Salicylic acid is used primarily as which of the following? Options A, analgesic. Options B, antipyretic. Option C, cough suppressants. Or options D, keratolytic agent. The right answer is options D, that is a keratolytic agent. Okay. Salicylic acid is used as a keratolytic agents. Okay. Salicylic acid is belong to the same class as like of aspirin. Its work by increasing the amount of moistures in that skin and also dissolve the substance that cause like skin cells to stick together. Applied topically for the treatment of like hyperkeratotic and scaling skin conditions such as like dandruff and seborrheic dermatitis, ichthysis, psoriasis, and acne. Okay. Questions number 22. Which of the following is an expectorant agent? Options A, glyceryl guaiacolate. Options B, codeine. Option C, wild cherry syrup. Options D, glycerin. The right answer is options A, that is a glyceryl guaiacolate. Okay, expectorant agents actually that's glyceryl guaiacolate. Okay, guaifenesin, which is also known as glyceryl guaiacolate, is an expectorant, that is a drugs which is used to control cough medications that add in the elimination of sputums from that respiratory tract. Chemically, if we see that it is an ether of guaiacol and glycerin, while that codeine is actually a painkiller. Okay. Questions number 23. The most prevalent adverse reaction of selenium sulfide is options A, dryness of skull, options B, irritation of skin, option C, discoloration of hair, or options D, loss of hair. The right answer is options B, that is the irritation of skin. Most prevalent adverse reaction of selenium sulfide is that irritation of skin. Selenium sulfide is actually anti-infective agents which mainly relieve that aching and flecking of the scalp and also remove the dry scaly particle that are commonly referred to as dandruff or seborrhea. It is also used to treat tinea versicolor, that is a fungal infection of the skin. Questions number 24. A disadvantage of chloral hydrate is options A, lack of absorption, options B, rapid elimination, option C, disagreeable odor, options D, allergic reaction. The right answer is options C, that is a disagreeable order. Okay. If we see the disadvantage of chloral hydrate, then we found there is a disagreeable order of chloral hydrate. Chloral hydrate is actually a sedative, which is mainly used in the treatment of insomnia, also to relieve anxiety and also to induce sleep before surgery. And also it is used after surgery in order to remove pain and also treat that alcohol withdrawal conditions. Okay. Questions number 25. Iconazole nitrate, that is spectazole, is most effective against options A, fungal infestation, options B, viruses, option C, rickettsia, options D, tapeworm. The right answer is options A, that is a fungal infestation. Iconazole nitrate, that is a spectazole, is most effective against like fungal infestations. Iconazole nitrates is actually antifungal drugs, belongs to that imidazole class, mainly used to treat skin infections such as like athlete foot, jock itch, and ringworm conditions. If we see that side effect which is associated with iconazole nitrate cream, like include burning, icking, stinging, redness, or other signs of irritation at the application site. Okay. Questions number 26. All tetracycline antibiotics, option A, have same chemical structure but are stereotypic isomer. Options B are isolated from Streptococcus rhinosus. Option C produces same side effect. Options D are destroyed by alkali hydroxide. The right answer is uh, options D. That is are destroyed by alkali hydroxide. All tetracycline antibiotics are destroyed by alkali hydroxides. Let's see some facts which is related to tetracycline. Like tetracycline is a yellow, odorless, crystalline powder antibiotic. It is stable in air conditions, but when it's exposure to that strong sunlight, it may become darkened. Okay, its potency is mainly that affected in a solution of pH which is less than 2, and it's rapidly destroyed by alkali hydroxide solutions. Tetracycline should not be used with like antacid because it forms insoluble complexes molecules with metal ions, chelations with various antacids. Tetracycline absorptions may be decreased by by more than 90% by these interactions. Okay. Questions number 27. Aminocaproic acid is used to treat options A, what? Options B, hemorrhage. Option C, hypertension. Options D, protein loss. The right answer is options uh, B, that is a hemorrhage. Aminocaproic acid is used to treat hemorrhage. Aminocaproic acids, that is actually anti-fibrinolytic agents. It's a medications which is mainly used to manage and treat acute bleeding disorder. Aminocaproic acid is used in managing hyperfibrinolysis induced hemorrhages. Okay. Questions number 28. The concentration of nitrofurazone solution used ophthalmically is options A 2%, options B 20%, option C 0.02%, or options D 1%. The right answer is options C, that is a 0.02%. The concentration of nitrofurazone solution which is used as ophthalmically is 0.02%. Nitrofurazone is an antimicrobial organic compound which is mainly belong to nitrofuran classes. It is used as a topical antibiotic ointment. It is effective against that gram-positive bacteria, gram-negative bacteria, and can be used in the treatment of trypanosomiasis too. Nitrofurazone is used to treat burn condition that have been infected. It is also used to treat skin infections, which is occur due to skin graft. Okay. Questions number 29. Dimethyl sulfoxide is no longer used clinically because it was found to produce options A, granulocytosis, options B, skin damages, option C, carcinomas, options D, eye damage. The right answer is options B, that is a uh, skin damage. Okay. Dimethyl sulfoxide is no longer used clinically because it was found to produce skin damage, that's eye damages. Okay. Dimethyl sulfoxide is actually that organophosphorus compound which is mainly used for cryopreservation of stem cells, also for the treatment of interstitial cystitis, and as also a penetrating vehicle for various drugs too. Questions number 30. Hetacillin is converted by the body to option C, ampicillin, options B, penicillin G, option C, penicillin V, options D, carbenicillin. The right answer is options A, that is a ampicillin. Okay, hetacillin is converted by the body to ampicillin. Hetacillin is actually a semi-synthetic penicillin. It's a prodrug and which itself has no any antibacterial activity, but it is converted in the body to ampicillin and has an actions and also use similar to like ampicillin. Hetacillin is prepared by reacting ampicillin with acetone. Okay, ampicillin may give a fake positive diagnostic test for glucose. Okay, that's much for today. Thank you.